Sometimes basic research can lead to unexpected partnerships and outcomes. A unique collaboration between two University of Adelaide researchers has brought us closer to finding a treatment for chronic pain, the fourth most prevalent health issue in Australia.
The pain first started in my right forearm one morning when I was doing some gardening. I think there were some times when the pain would be quite intense and generalised, maybe for a 24-hour period. And in that time it would be things like walking and the air brushing on my face would be a painful experience.
As my patient Alison described, she had initially a really mild local injury, which one would think would just cause some local pain. She described pain that was growing in area, crossed to the other side, and described quite marked disturbances of sensation. Even her hair brushing the area was intolerable. Patients like that were often told that they must have been imagining that this was all due to stress because people couldn't really understand the mechanism why the nerve cells became so sensitive. What we are doing is by looking at the contribution of the immune system to pain is to find out whether new treatments might be able to reverse the process and mean that people no longer need to take medication and can lead a much healthier life. And my colleague Mark Hutchinson has been leading the way in helping us understand in laboratory studies whether this is likely to be a worthwhile plan, and then my job is to see whether we can demonstrate that in people.
This work initially back in the 90s was really pushed back into the back stalls and ignored entirely. And now, here we are today, we have the first acknowledgement by the International Association for the Study of Pain that immune-like cells in the brain and spinal cord do contribute to pain. So what the opportunity is that we can use the fact that we now understand there's an immune system response in the spinal cord to perhaps look in the peripheral blood to see whether that same immune response is happening in the peripheral blood and use that as a marker for the degree of pain someone has. One of the challenges we're facing is today all of the drugs on the market to treat pain are targeting the wiring of the pain system.
But actually some of Mark's work has shown that many of the strong painkillers, in addition to acutely helping people, actually cause a danger signal to be elicited by the immune cell. That gives us a way of perhaps preferentially targeting the bad effects of these drugs from the good effects and restoring their activity.
I would hope that one day that I could maybe not take the medications that I'm on, maybe find another way of treating it, and I would hope that there'd be a time when I would find a way of being able to drive again. That would be the main thing if I could do that. And really my life, if it improved a lot, that would just be wonderful if I could have a life with more choices.
One of the major motivations of this work is not only is it scientifically interesting, but we may be able to have a significant impact to people whose lives have been so dramatically changed by this condition. Having talked to many patients, I've come to the view that chronic pain is the cancer of the soul. It erodes their life, their enjoyment, and the people around them. If we could make some impact in the lives of these people, that would be tremendous.